How we doing? My name is Chad from S&S Training Solutions. Today we are going to talk about triage. Triage, the word means to sort. So we're dealing with the mass casualty incident, right? We are looking at SALT today, right? So SALT is sort, assess, life-saving interventions, which take seconds, not minutes. Treatment and transport. Okay? So life is speed. Indecision is death. Okay? So step one, we're going to sort. So there are 4 categories when you're sorting. Green, which is minimal injuries, right? These are the walking wounded. To figure out who the green are, if you can hear me, come to the sound of my voice, right? Pretty simple, right? If they can hear you and they can move, they'll come to you. Yellow, okay? These are delayed individuals. These people can cry out and they can wave, but they can't really move under their own power, okay? So to find these people, if you can hear me, wave or cry out to me so that I can find you, right? Our reds, these are immediates. These are people that if they don't get care rapidly, they are going to decline to blacks, okay? And blacks are, the deceased. So these are people who are still, they don't make any noise, right? They're not moving, okay? And then your blacks obviously are expectant and dying. So things to remember: yellows can turn to reds quickly, and reds can just as quickly turn to blacks. Okay, so you can go from delayed to immediate, and from immediate to expectant quickly. All right. So once you figure out what your issues are, now you're gonna go through the assess stage. Okay. So we're assessing 30 respirations, 2-second perfusion, and a can-do in their mental, okay? Still patients, if they're breathing, then they have an airway. If they're not breathing, you open their airway, right? Adjust their head so that they can have an airway. If there's still no airway, they are black. Okay? They're expectant. You're not going to continue to waste time on them, because in a mass casualty situation, when seconds matter, you've got to move when you can. Okay? So bleeding, massive bleeding, you're gonna pack with tourniquets, right? Tension pneumothoraxes. If it's in your scope, we're gonna do needle chest decompressions, and then auto injectors. This is for chemicals or anaphylaxis, right? So if someone had an allergic reaction to something, you're going to hit them with an epi. Okay, so life-saving interventions. That's what those are: breathing, bleeding, tension pneumothorax, and antidotes for chemicals and anaphylaxis. And they should take seconds, not minutes. Okay, when you're dealing with children, the breathing portion, we use something called jump start. Okay, jump start. When you address their airway, if they're still not breathing on their own, you perform 2 rescue breaths, and if they're still not breathing after you've done the rescue breathing, that's when you assess them as expectant. Okay, so step 4 is going to be treatment and transport. Okay, so immediate treatment is your reds. Life-threatening but treatable injuries. these are based on environment and environmental conditions, transport time. Okay, if you're inside of the golden period for treatment, if you're in the back country, someone who is a red is probably going to be expectant or black because of time. All right, so you're going to treat them the best you can, but eventually you're going to run out of resources and they are going to wind up expectant or dead. Okay, so just remember, you can't save everyone. Okay, we're going to try, but you can't save everyone. Yellow, delayed. These are serious but stable. Okay. Green, minimal, minor injuries. All right, minor. The expectant are dead. They're already dead. Okay, already dead, meaning they're not breathing, their heart's not beating, no pulse, so you don't have any perfusion, right? Or you expect that they're going to die because they have injuries that are incompatible with living. Okay, so if their inside parts are outside of their body, they're probably not going to live. Constant reassessment is required. Okay, so your greens are the third priority. You're not going to treat these people until you have the time and the resources to treat them. Okay, your yellows, they're your second priority. Your immediates, your reds, they're your first. They are obvious life-threatening conditions. Okay. So, when you assess their breathing, okay, if they're breathing, can they obey commands? Do they have a peripheral pulse? They're not in a respiratory distress, and the bleeding is controlled. If all those are a yes, they're green. That's a minor, all right? If any of them is a no, they're likely to survive, right? So if they don't have if they're in current respiratory distress, they're probably going to be expectant, right? If any of those conditions, obey commands, peripheral pulse, no respiratory distress, bleeding is controlled, if any of those are a yes, they're going to be immediate. Okay. So other things that you need to take into consideration is their mental status, right? So obey commands. That's mental status. All right. So we use the Glasgow Coma Scale, right? The GCS scale. So the first portion of that is eye-opening, right? When you speak to them, if they open their eyes spontaneously, they're a 4. If they open their eyes when you tell them to, they're a 3. If they open their eyes to pressure, they're a 2. If they don't open their eyes, they're a 1. There isn't a 0 in any of these categories, okay? Verbal, right? So if you ask them questions and their responses are appropriate, they're a 5. If they're confused, if their responses are confusing, or they're not sure, that's a 4. If their responses are inappropriate, that's a 3. If their responses are unintelligible, right, that's a 2. Unintelligible, they're making noises, they're not actually talking. And none is a 1. Then we get to motor function. Follows commands is a 6. They localize to pain, that's a 5. They have normal flexion, that's a 4. If they have abnormal flexion, that's a 3. If they're in a state of extension for their motor function, they're a 2. And if they have 0 motor function, that's a 1. Okay? Somebody that has a GCS of less than 14 and has abnormal pupil reactivity, that can indicate a life-threatening traumatic brain injury. So when you're checking for mental faculties, check their eyes. You're looking for pupils equal, round, reactive to light. Pearl. Okay? If one of their pupils is not equal and reactive, you may have a bleed, putting pressure on optic nerves. So you want to that is a mental condition that's going to be an issue, right? So you're going to elevate that person because they have a mental problem now, right? If they fail to follow commands, or they have an obvious brain injury based on your assessment, they're an immediate, okay? Now remember, this is education. All right? I am a trained medical professional. Go get training. Come see me for training. All right? We hold wilderness classes, and we hold Stop the Bleed. We do Heart Saver and Basic Life Saver CPR. Come to S&S Training Solutions. Link in the description. Have a lovely day.